In this short video, we will cover how to use the SyncTimes front desk system. By incorporating the front desk, the SyncTimes system will be able to display patient identifiers on the exam room tablets and flow stations. This will help clinical staff understand who is in the room without looking in multiple areas. To get started, we will cover how personnel at the front desk will input information. After logging into the flow station, you will see some input fields on the right, as seen on this screen here. This is where you will input the patient's assigned provider, first and last name, and appointment time. So let's say this patient is here to see Dr. John. So I can just type in John and it'll automatically find Dr. John for me. I just hit enter and it'll select him. The patient's name, this can be typed in or copied and pasted. And then when we get to appointment time, we can just start typing in the numbers. So let's say this was the 11:30 appointment, so I'll type in 11:30 a.m. and it'll autofill all of those values for you. Then you can hit tab or enter and it'll add that patient for you. And then what we see is after those input fields have been completed or filled out, that provider comes down here to the waiting list. These patients will be grouped by provider and will display the patient's initials and appointment time. If an appointment time is not entered, it will indicate that this is a walk-in patient. So what we see here under Dr. Sally's section is David Smith, so DS, walk-in appointment, has been waiting for 0 minutes. So with this list, clinical staff will be able to look at the flow stations and not only see each exam room, but they'll also be able to see which of their patients have arrived in the waiting room and how long they have been waiting there for. The flow stations in the back office or in the clinical setting will not display the input fields but will only display the waiting list. Once a patient has been roomed and added to an exam room, the patient's initials and appointment time will appear here on the exam room. Now we realize that this system is adding additional manual entry for front desk staff, so I just want to emphasize quickly that the goal of this is to first validate whether or not this adds additional value for the clinical setting, and if that is the case, then we'll go ahead and automate this process with some sort of EHR integration so that the patients, as they're checked into ECW, will automatically be populated into the waiting list as seen here. Adding a patient to the exam room is pretty simple. When you are rooming a patient, you only need to badge in to add a patient. That means you don't need to tap on this circle anymore. You just badge in and the patient will automatically be added for you and the patient list will appear. You simply select the patient and hit add selected patient. If you wanted to add an additional patient, you can click on the patient's name here, or you can click on this icon in the top left and select additional patients to add into the room, or you can remove patients from the room. Patients are organized first by the provider assigned to the exam room, then all of the patients for the department, and then checked out patients. So if a patient has been removed from one room for any reason such as relocating back to the waiting room or is moving to a different exam room, if you take that patient out of a room, that patient will appear in the checked out section here at the bottom for an hour before they disappear from the system entirely. That is it for the new front desk integration in the SyncTimes system. We appreciate your willingness to pilot this new system and we look forward to hearing your feedback on what's helpful, what may not be helpful, and how we can improve the system for you at your health center.